Hi everyone, we're going to talk for a little bit here on dementia. There are many types of dementia, and Alzheimer's disease is the most common. There is some vascular dementia, which is the next most common, followed by dementia with Lewy bodies. Mixed dementia has features of more than one cause is also common. So to talk more about these during our presentation, some of our objectives are going to be to summarize the causes of dementia, to synthesize current dementia research and future directions, to differentiate normal aging and dementia, evaluate risk factors, and generate diagnoses and medical management, and then support families and patients in recognizing the symptoms of dementia, those living with dementia and dementia-friendly communities, and alternative therapies. So let's first talk about mild cognitive impairment. This is a condition in which people have more memory or other thinking problems than normal for their age, but their symptoms are not severe enough to interfere with daily life or their ability to function independently. Symptoms of mild cognitive impairment may include forgetting important information that he or she would have previously been able to recall, such as appointments, conversations, or recent events, decreased ability to make sound decisions, judge the time or the sequence of steps needed to complete a complex task, or have trouble with visual perception. A person with mild cognitive impairment is at an increased risk of developing Alzheimer's or other dementias. And in some cases, the condition may be caused by external factors such as medication, vitamin B12 deficiency, or depression. In these cases, the condition can be reversed on its own or remain stable. But intervention to correct those medical conditions is important. So dementia is a general term for a decline in mental ability severe enough to interfere with daily life. It's not a specific disease. It's an overall term that's used to describe a wide range of symptoms associated with a decline in memory or other thinking skills. It's not part of normal aging. It's caused by damage to brain cells from the disease or trauma such as a brain injury or a stroke. This damage interferes with the ability of the brain cells to communicate with each other. And when brain cells cannot communicate normally, thinking, behavior, and feelings can be affected. The different types of dementia include Alzheimer's disease, vascular dementia, dementia with Lewy bodies, mixed dementia, Parkinson's disease, and frontotemporal dementia. And we'll go over a few of these, and then we'll go over a few of these, and then we will further elaborate on some of them on future slides. But I do wanted to say a little bit about dementia with Lewy bodies. It's a memory loss and thinking problems that are common in Alzheimer's disease. These folks are more likely to have initial or early symptoms such as sleep disturbances, well-formed visual hallucinations, and muscle rigidity or other Parkinson-type movements. Mixed dementia. These abnormalities are linked to more than one type of dementia, and they occur simultaneously in the brain. Researchers are finding increasingly large amounts of data to support that this type of dementia has a mixed pathology. Then there's also Parkinson's disease, which is brain changes that begin in a region that plays a key role in movement. As changes gradually spread, they often begin to affect mental functions, including memory and the ability to pay attention. These individuals may have difficulty with making sound judgments and plan steps that are needed to complete a task. Now, with the frontotemporal dementia, typical symptoms include changes in personality and behavior and difficulty with language. There are nerve cells in the front and side regions of the brain are especially affected by this type of dementia. Also, there's the Creutzfeldt-Jakob disease, which is a rapidly fatal disorder that impairs memory and your coordination and causes behavioral changes. It was once termed the mad cow disease, as it occurs in cattle and has been transmitted to people under certain circumstances. We also have, while we're talking about these types of issues, normal pressure hydrocephalus, which are symptoms including difficulty walking, memory loss, and inability to control urination. This is caused by a buildup of fluid in the brain. We also have Huntington's disease, which is a progressive brain disorder caused by a single defective gene on chromosome number 4, and symptoms include abnormal involuntary movements, a severe decline in thinking and reasoning skills, irritability, depression, and other mood changes. And then also there's Wernicke-Korsakoff syndrome, which is a chronic memory disorder caused by severe deficiency in vitamin B1, thiamine, and its most common cause is alcohol misuse. You will see memory problems that may be strikingly severe, while other thinking and social skills seem relatively unaffected. So of all of these, the Alzheimer's disease and the vascular dementia are the most common types of dementia, and we'll get ready to talk about those. So, as we said, the most common type of dementia, and it accounts for an estimated 60 to 80% of these types of cases. Alzheimer's disease is a progressive disease in which dementia symptoms gradually worsen over a number of years. In its milder stages, in its earlier development, people experience some memory loss, but in their later stage, with severe Alzheimer's disease, individuals lose the ability to carry on a conversation and respond to their environment. The degenerative nature of the disease means many in the severe stage have difficulty moving, often becoming bedbound and need around-the-clock care. I don't have a picture here to reflect it, but if you were to look at the size of a healthy brain and an individual that had severe Alzheimer's, you would see that the Alzheimer's brain is significantly smaller than the healthy brain. In vascular dementia, it's the second most cause of dementia. It occurs in 20 to 30% of cases. Vascular dementia is a decline in thinking skills caused by conditions that block or reduce blood flow to the brain, and these deprive brain cells of vital oxygen and nutrients. In vascular dementia, changes in thinking sometimes occur suddenly following strokes where you have a major blockage in the blood vessels of the brain, and thinking problems may also begin as mild changes that worsen gradually as a result of multiple minor strokes or other conditions that affect smaller blood vessels, leading to cumulative damage. Researchers are increasingly believing that many people have mixed vascular dementia and Alzheimer's. A little bit of history of Alzheimer's. It was first identified in 1906 by Dr. Alois Alzheimer. He noticed certain changes in the brain tissue of a woman who had died after a mental illness that included symptoms of memory loss, language problems, and unpredictable behavior. Dr. Alzheimer examined her brain after her death and found many abnormal clumps, now called amyloid plaques, and tangled bundles of fibers, now called neurofibrillary or tau tangles. These plaques and tangles in the brain are still considered some of the hallmarks of Alzheimer's disease, along with the loss of connections between nerve cells, which are the neurons in the brain. Alzheimer's disease is a progressive neurodegenerative disease that is clinically characterized by impairment of cognitive and functional abilities together with behavioral symptoms. Alzheimer's is not just a disease of old age. As you can see here, it affects many individuals in their 40s and 50s. There is a classification of it called younger onset Alzheimer's that affects people younger than 65. Many people with this early onset, as we said, are first noticed in their 40s and 50s. In the U.S., it's estimated that approximately 200,000 people have younger onset Alzheimer's, and up to 4% of the population, and this is up to 4% of the population that has Alzheimer's disease. So some of the physical changes that we'll see with Alzheimer's is we know that there's nerve cell death and tissue loss throughout the brain. And over time, the brain shrinks dramatically, affecting nearly all of its functions. Scientists are not absolutely sure what causes the cell death and tissue loss in Alzheimer's patients, but plaques and tangles are primary suspects. Plaques, again, are the abnormal clusters of protein fragments that build up between nerve cells in the brain, and these plaques form when protein pieces called beta amyloids clump together. Dead and dying nerve cells contain tangles, which are made up of twisted strands of other proteins. Plaques and tangles tend to spread through the brain in a predictable pattern as Alzheimer's disease progresses. Stages of Alzheimer's disease. On average, a person with Alzheimer's will live approximately 4 to 8 years after a diagnosis, but can live as long as 20 years depending on many factors such as the progression of the disease and other co-occurring conditions, infections, or unintentional injuries. The symptoms of Alzheimer's disease will worsen over time, although the rate at which the disease progresses varies. Alzheimer's disease typically progresses slowly in 3 general stages: mild, which is considered the early stage; moderate, middle stage; and severe, which is the late stage. In the early stage, a person may function independently. He or she may still drive, work, and be part of their normal social activities. Despite this, the person may feel as if he or she is having memory lapses, such as forgetting familiar words or the location of everyday objects. Other common difficulties in the mild stage of Alzheimer's disease include trouble remembering names when introduced to new people, having greater difficulty performing tasks in social or work settings, forgetting materials that once they had just read, and increasing trouble with planning or organizing. In the middle stage, as the disease progresses, the Alzheimer patient will require a greater level of care. In the moderate stage, damage to the nerve cells can make it difficult to express thoughts and perform routine tasks. During this stage, symptoms will be more noticeable to others and may include forgetfulness of events or knowledge of one's own personal history, confusion about where they are and what day it is, the need for help choosing proper clothing for the season or the occasion, trouble controlling bowel or bladder, changes in sleep, such as sleeping during the day and restless at night, and an increased risk of wandering and becoming lost. There may be personality and behavioral changes, including suspiciousness and delusions or compulsive behaviors. You may also note even repetitive behaviors like hand wringing or tissue shredding. In severe Alzheimer's stage is typically the longest stage and can last for many years. In this stage, individuals lose the ability to respond to their environment and to carry on conversations and eventually to control movement. They may still say words or phrases, but communicating becomes more difficult. As memory and cognitive skills continue to worsen, personality changes may take place, and these individuals need extensive help with daily activities. At this stage, individuals may require full-time around-the-clock assistance with personal care, loss of awareness of recent experiences as well as their surroundings. They may experience changes in physical abilities, including the ability to walk, sit, and eventually swallow. These patients also experience changes in physical abilities, including the ability to walk, sit, and swallow, and they are more vulnerable to infections, especially pneumonias. So this is a slide talking on the focus of resilience with their cognitive reserve. Some people with neuropathological changes of Alzheimer's disease do not have dementia and indicate resilience. This figure illustrates how some individuals in community-based U.S. studies who are cognitively healthy tolerate a large and mixed burden of vascular Lewy body and Alzheimer's neuropathology. These findings have led to the concept of cognitive reserve, which is that people who have such brain reserves can tolerate more neuropathology without cognitive and functional decline, and therefore develop dementia more slowly than others without this type of brain reserve. This reserve is related to either brain anatomical substrates or adaptability of the cognition. The theory suggests that less cognitive reserves lead to earlier development of dementia, and furthermore, it suggests that populations with, for example, increased rates of hypertension might develop dementia earlier because the resulting neuropathology reduces the cognitive reserve buffer. So some research that is in progress. There's new drugs, as we hear every day, that are focused on beta amyloid formation. We have new drugs in research that target the tau protein, and drug in research that target inflammation of the brain. But let's talk a little bit about risk factors. So, currently, researchers don't fully understand what causes Alzheimer's disease in most people. As we talked about earlier, in most cases, it's likely a combination of genetic, environmental, and lifestyle factors that take place over a long period of time. A number of risk factors have been identified that contribute to the development of Alzheimer's disease. Other risk factors show evidence of decreased risk pending further research. The greatest risk factor for Alzheimer's disease is advancing age, and most individuals with the disease are 65 years or older. However, Alzheimer's and dementia are not normal parts of aging, as we talked about. The risk of developing Alzheimer's disease increases with age and approximately doubles every 5 years after 65. In persons aged 85 or older, about 1 in 3 have Alzheimer's disease. Race and ethnicity may also contribute to the increased risk of Alzheimer's and other dementias. In the U.S., older African Americans are more than 2 times more likely than older white Americans to have Alzheimer's. First-degree relatives of African Americans with Alzheimer's disease have a 43% chance of developing dementia. Older Hispanics are about 1.5 times more likely than older whites to have Alzheimer's disease. So these variations in health, lifestyle, and socioeconomic circumstances across racial groups likely account for most of the differences in the risk of Alzheimer's and other dementias by race. African Americans and Hispanic communities have a higher incidence of certain Alzheimer's factors. These conditions, such as high blood pressure and diabetes, which are risk factors for Alzheimer's disease, are more common in African Americans and Hispanic populations than in whites. And also lower levels of education and other socioeconomic characteristics, such as lower income, access to quality care among older racial and ethnic minorities, may also contribute to this increase. Some studies suggest that differences based on race and ethnicity do not persist in rigorous analysis and take those risk factors into account. So let's look a little bit more even at breaking down by gender. Almost 2/3 of U.S. adults and Alzheimer's disease patients are women. Among those aged 71 and older, 16% of women have Alzheimer's and other dementias compared with 11% of men. At age 65, women without Alzheimer's disease have more than a 1 in 6 chance of developing Alzheimer's during the remainder of their lives, compared with a 1 in 11 chance for men. And women in their 60s are about twice as likely to develop Alzheimer's disease over the rest of their lives as they are to develop breast cancer. This may be primarily explained by the fact that women live longer on average than men do. However, researchers are increasingly questioning whether there may be other reasons for the differences in the number of women and men developing the disease. So here is a table of proposed risk factors and protective factors for late onset dementia and Alzheimer's. You can look at those at your convenience. Alzheimer's disease must be considered a public health crisis, and there's many reasons to believe this. First, the burden is large and it's continuing to grow. Today, over 5 million adults in the U.S. are living with Alzheimer's disease, including an estimated 200,000 under the age of 65. And 1 in 9 adults age 65 and older, which is about 11%, currently has Alzheimer's disease, and approximately 1 in 3, which is 32%, of people aged 85 and older have the disease. And as we talked about, women make up almost 2/3 of the seniors living with Alzheimer's disease in the United States. Alzheimer's disease is the 6th leading cause of death in the U.S. and the 5th leading cause of death of those 65 and older. Deaths from Alzheimer's has increased 71% from 2000 to 2013, while deaths from other major diseases, including stroke, breast and prostate cancer, HIV, and AIDS, have all decreased. Alzheimer's disease is the only disease of death among the top 10 in America that cannot be currently prevented, cured, or even slowed. So compared to other top causes of death in the U.S., death from Alzheimer's has increased significantly while deaths from others have declined. And we can see here from the 2000 to 2013 the percentages change in death. HIV is decreased by 52%, stroke by 23%, heart disease by 14%, influenza and pneumonia by 13%, prostate cancer by 11%, breast cancer is down by 2%, but Alzheimer's has increased by 71%. I think we're going to take a break. We're about probably over halfway through with our slides, but this is going to be too long a video if we keep going. So let's take a break and we'll come back to talking about financial burdens.